between these two systems. You're using the cannabis tracking system. We are now in the process, as directed by you, of doing the medical bump up. We will be directing Franwell Metric to make changes in our system, on our contract, to accommodate patient sharing directly out of the bump up canopy that has been provided. So, harmonizing the way those things happen between, I'm not quite sure if it's the new Cannabis Commission or who's going to be pulling those parts of resolution together. I know we certainly have a role through agreement in this process. But I think then if you have differences in the way those things are done, you have more confusion. Certainly if we have the responsibility, we have more training to two different ways the medical product may be tracked. Both at staff level with licensees, and I think the public who's kind of they know about the history of the medical system, they know we have recreational, but the interface of the two is definitely confusing to the outside public, to public officials, to law enforcement. Also, then if the data is going to be of more utility to us to maybe prove up to people who are peeking under the hood looking, federals, we want to make sure, or I think we would want to make sure that we have alignment of the data so we can show in similar ways what's being produced inside the legal systems in Oregon. And then there's this timing issue. How long before this medical tracking, the board that devised it is going to be ready to do that tracking? When is that coming? Is that 3 months, 6 months? And I know there's some dates in the memo. I'm sorry I don't have them retained yet. So, I think there's some cost effectiveness to fully utilizing the system we have in place. I think we've proved up in terms of our participation with the user communities of the system that we're willing to work very hard to make those interfaces and that product usable. Certainly we would do this if we've already had discussions about how can we make the tracking interface simpler for sharing out to patients on that product with our contractor.